I want to talk to you guys today about something really uncomfortable, possibly for some of us or you, and just something that I see in the marketplace. My name is Mary Gardner, and I work with lots of CEOs of hospitals and healthcare organizations. I'm a former celebrity lecture agent and publicist and own one of the first coach training companies in the world. I also worked at Goldman Sachs as a corporate trainer. And later on, my son was diagnosed on the autism spectrum. So I jumped off the track and stopped really working on me and started working on him. And what I realized is that through careful consideration of our diet and changing a lot of things and our lifestyle, my son became a person who was highly functional and healed basically off the spectrum. I ended up writing a book about it in 2011, 𝗕𝗰𝗴 Chaos, which is on Amazon, of our really harrowing, unbelievable journey. And so I wanted to talk to you about right now in the healthcare field, there is a big mistrust that is post-pandemic, and it had to center around the vaccines and all of the mandates that were coming down and the shutdowns and everything. And I was really lucky that I have knowledge that other people didn't have. And so I want to talk to you about, as you rebuild this trust in the marketplace, which we have to do, and healthcare is not going away. I heard a quote today. One of the best things was that healthcare, the second word there, is the most important, is care. So I wanted to talk to you because this is an uncomfortable situation for a lot of the docs and a lot of the hospitals that I'm working with. And I desperately want to help because our country is sick and needs to get well. We need to get healthy. And so it makes sense. We've all been through a lot. We've been through a lot of trauma, and now we are building back. So we're all kind of trying to figure it out. And I have a broad scope because I work with a lot of different individuals in the healthcare organization. So I wanted to give a couple of suggestions for the docs and for the healthcare workers of things they can talk to people. If you don't do this, I don't think it's going to start creating that trust yet, because it's got to be more communication between patient and doctor. So when patients come in, I think the best thing to do is to ask a lot of questions that are caring questions. First of all, ask what's working in your opinion and what isn't. Now, their opinion is really important. And lifestyle, as I've seen it, and health and nutrition are one of the core things. When you're eating bad food, you're going to have a bad history of health. So what's going on in your opinion and what isn't working well? And then what do you think you could do better? We're going to do what we can do, but you have to work on it too. What are you able to do in your life to help the situation? And number three, can you find yourself a mentor in the area of health? So I understand the docs that I work with are highly intelligent. And the thing of it is that there are different ways to skin the cat. I just had a religious conversation with someone this morning. She was absolutely certain on her religion. And I was like, well, you don't necessarily know our stance on things. And because you're not educated in it, it's a different way of looking at things. So if we say that everybody's going to find their own way, it would be good for the docs to be able to ask what is working and what isn't working in your opinion. What could you do better? And can you find a mentor to help you, somebody that's already gone through this process? And then again, we do what we can do, and you're going to do what you can do. I think that can start bringing the trust back in the healthcare organization. And I just am cheering you guys on. I personally am into all natural health, and I love sharing that with the docs and the hospitals and the healthcare organizations that we work with. I am a business development professional for a telehealth organization that also brings the nutrition and supplements and lifestyle coaching, and it's all Medicare, Medicaid, and insurance approved. So if I can support you with that and share that information with you, I would love to. All right, guys, I hope this is a welcomed video today, a little out of the box for a communication executive, but look forward to hearing your comments below, and I look forward to seeing you soon. And get healthy, America. We got to take control and get ourselves back in a good place. All right, guys, take care. Bye-bye.